Hello, my name is Colleen Hartland. I'm the Greens Member of Parliament in Western Metropolitan. I came to learn how important Auslan is when the state government tried to cut out the training facility at Kangan TAFE. I learnt that it is a pivotal way for people to be able to communicate, and because I'm fascinated by language, because I don't write very well and I'm intrigued about the way people do communicate with each other, that this became quite important to me. And so today I'm going to be answering questions from the community about what the Greens will do about important issues for you. The first question is, what are you going to do about the current unsatisfactory and at times unsafe, unethical issues surrounding access to qualified, independent Auslan interpreters in public hospitals, and detailed in the recent Deaf Victoria report? There has been a lot of discussion recently about the issues and shortfalls regarding the provision of quality Auslan interpreting in hospitals in Victoria. What is your plan to address the inadequacies in this system and improve the situation regarding interpreter provision for deaf people? When you go into a hospital, if you're deaf, you should be able to have an interpreter, because what could be more important than having someone to assist you to understand what the doctor, the nurse or the allied health professional is telling you? The Greens will call for an inquiry into these services to make sure that what is actually happening in hospitals is of the highest standards. We will also need to make sure that hospitals receive funding so that they can actually supply these services. Question 2. The state government used to offer annual grants to local government to improve accessible infrastructure from a program called Building Inclusive Communities. This funding has been stopped. Would your party be prepared to lobby for its return? If yes, what is the possibility of grants to improve community access for deaf and hard of hearing to be included in that funding? These grants to local government are really important because they're around making sure that people in wheelchairs had access to shops, making sure that toilets were accessible. Clearly the things that could be done for the deaf community would be around hearing loops, would be about having interpreters at council meetings and council consultations. I believe that the deaf community should be just as entitled to grants for inclusion as any other community. These were important grants, and again it was one of those things where the state government cut off funding and just expected local council to pick up the cost. Local councils shouldn't have to always pick up the cost where it clearly is a state government or federal government responsibility. So we would lobby for the return of those grants. Question 3. The current Victorian education system is promoting further inequalities in accessing specialist schools. For example, deaf facilities are not classified as special schools and government taxis and buses are not provided. Instead, a paltry conveyance allowance is given to families. Some deaf facilities follow a particular communication approach, and some families are forced to choose outside their zone deaf facility and risk losing their conveyancing allowance. For many, they cannot manage the driving to the deaf facility, managing other kids' transport to local schools and getting to work on time. Increasingly, we are seeing more deaf kids mainstreamed into school with little or no support. Deaf education access should not be about bean counters. Can we allow deaf facilities to be classified as special school settings and reintroduce taxis for deaf students so they can have equal and proper access to education and relieve the pressures on families? This is a really interesting question. And I'm also getting very similar questions from families where there is a child with autism who needs specialist education, a child who might be in a wheelchair but the local school's not accessible. So clearly there is a problem across the entire educational stream about children who have disabilities but could be going to mainstream schools with support. And as I understand it from Deaf Victoria, often the people who are being assigned to deaf children do not have adequate interpreting skills. This shouldn't go on. We know that for young deaf people, being able to access good schooling will lead on to being able to access employment. We need to be looking at access for children with disabilities across a range of disabilities to make sure that everybody has the access they need. And again, in the first question, I talked about the need for review. This is also an issue that I think state government will need to review to make sure it is happening properly, and especially in relation to NDIS. Question 4. What is your stance on unaccredited Auslan and English interpreters working in Victorian schools, and will you make changes to the current Department of Education policy to make it mandatory for Auslan English interpreters working in schools P1 to 12 to hold NAATI accreditation? When will the Education Department demand Auslan and English interpreters hold NAATI accreditation as the minimum qualification to work in schools, just as it is mandatory for teachers to be qualified? And what will your party do on this? I totally agree with this problem, that we have to be able to have accredited interpreters, whether they be Auslan or English interpreters, working in schools so that children are getting the best education they can. You're right, teachers have to be qualified, interpreters should have to be qualified as well. Question 5. What will you do to promote and invest in accessible tourism so that up to 35% of Victorians that experience disability, either personally or through family members and friends, can enjoy near to full access to many tourist attractions in Victoria? One of the things that the Greens believe in is around the accessibility of buildings, around accessibility to walking tracks, so that anybody who wants to go to the museum or the library or the art gallery or go on a bushwalk has the same access as everybody else. Yes, this will take money. Yes, it will take some imagination, but it is not impossible. And if we're going to keep on talking about how we want to include all Victorians in all of the activities, whether they be arts, culture or tourism, then we have to be able to provide the facilities to do it. Question 6. The community needs an advocate that will embrace the model of disability that recognises difference for positive social and economic outcomes and removes the negative language that associates someone's genuine needs with burden. The disability sector is a booming industry wanting to be supported and recognised. Imagine the jobs and benefits to society if disability access was embraced. If public spaces and services were accessible, the benefits would be enjoyed by all. For too long, the perception that people with disabilities are not capable is wrong. Sorry about that. People want to be independent and contribute. It is the current attitudes and lack of access that is causing most dependence and disability. Not supporting people with different costs society more in the long run and socially and economically. I couldn't agree with this statement more, and it's every time, especially I speak to a young person with any kind of disability, whether they're in a wheelchair, whether they're deaf, whether they're vision impaired, whatever the disability is, not being able to access a full range of services, not being able to access all buildings, not being able to get on a train easily to go to work so that they're always dependent on taxis, is not the way you include people into the community, especially into the workforce. The federal government keeps on talking about people who have disabilities who should be able to go to work. But if you're in a wheelchair and you can't get in that building or you can't get on the train, if you're deaf and your employment won't make concessions for that disability, won't give you the equipment that's required, if you're vision impaired and your employer won't help with the equipment that you need, how are you going to be expected to be able to be included? Part of people being able to go to work, we have to be realistic about what people need and not have it as some kind of, oh, we're being really nice to you. No, it's just about everyday requirements. On the issue of stigma, we have to change all of our attitudes about this, and we shouldn't be seeing someone in a wheelchair or someone who's deaf as, oh, they're heroic, overcoming their disabilities. No, they're a person with a disability, and that's all we should talk about, not anything else. That's all our questions for today. Thank you very much to everybody who sent in the questions. They were very broad ranging and they make you think a lot about what's required for the community. I hope I've answered your questions, but please don't hesitate to contact me via Facebook if you have any other inquiries. Thank you very much.